Our last two episodes have focused on meibomian glands and the identification of meibomian gland dysfunction. We feel that this is a relevant topic because 86% of patients with dry eye have MGD. In this episode, we want to focus on treatment. In the best case situations, glands flow freely, releasing meibum into the tear film to help lubricate and decrease evaporation. When glands are plugged, the system comes to a screeching halt. Regardless of severity of MGD, we start off by removing any keratinized tissue. This is best seen with lissamine green, and then other debris that's overlying the gland's opening. This lid cleaning has been shown to improve meibomian gland function overall. From what we have seen in the literature and in our offices, we feel that the gold standard for treating meibomian gland dysfunction is LipiFlow, which utilizes a device called an activator. The scleral cup rests upon the cornea and has an outer embedded heater releasing heat that is targeted at 42.5 degrees Celsius. In addition to the heat, the activator has an air bladder that applies pressure onto the eyelid surface ranging between 0 and 6 psi. Because it heats from the inside out, the meibomian glands receive the heat directly, and the pressure is optimal because it applies to the correct area and at the appropriate force for the eyelid. The longevity of the treatment can last between 6 months and years, depending on the severity of the gland atrophy prior to treatment, and perhaps more importantly, the habit of the patient following treatment, particularly with regards to their blinking habits. Instead of LipiFlow, most practitioners recommend that their patients use warm compresses. Just like your patients, ours do this for like 2 days and then they stop, thinking that it's cumbersome, frustrating, and that they hate it. Although some of us use fancy heat masks or goggles, few of our patients heat their glands correctly in an effort to actually get the congealed meibomian glands to the recommended or preferred temperature of about 40 degrees Celsius. If we have a highly motivated patient that elects against LipiFlow, we will use this method taught to us by our hero, Don Korb. Roll up 5 wet washcloths, heat them in the microwave so that they're not burning but they're very hot. Then place them on the eyes for 10 minutes, removing the outer, cooler washcloth every 2 minutes. Outside of a heat source that's inside the eyelids, this may be the best method for rapid and complete conduction of the heat from the washcloths through the outer skin, lid structure, and tarsal plate into the meibomian glands. For non-motivated patients, we do goggles and simply hope for the best. One study performed by Lane and colleagues tested patients with LipiFlow and warm compresses. After 2 weeks of completely compliant, properly performed warm compresses, patients showed some improvement, although it was very minimal compared to the other group of patients who had done LipiFlow. Another treatment that many people use following warm compresses is to do lid massage. Since many patients do this incorrectly, and since there has been evidence of corneal damage from rubbing a heated cornea, we avoid this practice altogether in our offices. Some clinicians use devices to express the contents of the meibomian glands. We're uncertain as to the long-term benefit and the amount of meibum actually being evacuated. We also have reservations concerning forcing the material out of the glands by pressure, which must tear the obstructed material from the walls of the duct, not to mention the pain. One article demonstrated that in order to be effective, it's necessary to use more than 10 psi of pressure, which was intolerable to over 75% of the patients. If you do this procedure in your office, we suggest prepping the patient for the pain and then with 5 to 10 minutes of warm compresses in an attempt to melt some of the obstructive meibum. Lastly, we want to discuss what we believe is the primary cause of glands becoming plugged in the first place, and that's blinking, or a lack of it. When glands are not activated with good blinking, they plug. The best time to teach your patients how to blink correctly is immediately. Improving blinking does not help to improve the flow in glands that are plugged, but we suggest working to change habits as soon as possible in anticipation of future freely flowing meibum. Blinking instructions are as follow. Close your eyes tightly without using any of your facial or brow muscles. Now open them and close them forcefully and tightly. Do a session of 20 blinks every hour for 2 weeks. Once glands are working again, We have seen this exercise to make a huge improvement, as seen with these two patients on the screen. Some think our methods to be excessive for someone who doesn't really have end-stage disease. A patient with pressures of 30 and a mild visual field loss is synonymous to a patient with low MGE scores and gland atrophy. Symptoms are not. Glaucoma will continue to cause nerve damage, and the glands that are not flowing will continue to die. Unless it's treated, both will eventually result in symptoms. For patients with plugged glands, we recommend LipiFlow. If you don't have a machine and don't have access to one, then scrape, do warm compresses, and do in-office expression. Then send your patient home for a 2-week session of BID 10-minute warm compresses, as we have outlined previously. See your patient back 2 weeks later, and if their glands are flowing freely at each visit, see them at 1 month, 6 months, and then every year. If you do not see a dramatic improvement in their meibomian gland expression, we'd suggest that you refer to a dry eye center in your area and have the patient treated with LipiFlow. Instruct the doctor that you refer your patient to send the patient back to you for follow-up and co-management. Doing the right thing for your patients is like most things in life. It's simple, but not always easy. Scrape, heat, guided massage, and blink. Follow that up with an appointment to ensure the glands are flowing. If they're not, send your patient out. Preserve your patient's glands. Doing so will improve their comfort, satisfaction, and success.